Hello, I'm Dr. Lacey Lee from Cat Care Center of Baton Rouge, and today we want to talk to you a little bit more about some of the aspects of senior and geriatric cat care. I have my assistant, Abby Santini, who's going to be asking some specific questions, and I'm going to be giving some answers and going over some information, so we hope to help you better understand some of the unique aspects of taking care of your senior cat.
Dr. Lacey, how will getting older impact the health of my cat?
Well, so getting older, first of all, senior cat care is defined by life stage guidelines. However, just remember definitions aren't hard and fast, and sometimes our cats do get older sooner and some of them get older later. So it's really an individual cat thing. It's an individual aspect that you and your veterinarian will determine together. But usually the ages are between 10 and 11. 11 to 14 is senior cat life stage, and then 15 plus is geriatric. And as these guys start to get older, there are some unique things that you're going to start to need to think about, including some behavior changes, some nutritional changes, some specific veterinary medical changes that'll need to be addressed, as well as some home environment changes. So hopefully, when you address all those categories when speaking of a senior or geriatric cat, you're looking at them as a whole and helping them enter their golden years as healthy and pain-free as possible.
How do a cat's nutritional needs change as they age?
Well, this does happen when they enter into the senior life stage. And one of the things that happens is that they don't absorb their food as well, and they also can't tolerate large meals. So for those that like to feed their cats twice a day, or maybe feed a big serving in the morning and then the cat just eats throughout the day, a lot of these guys, they're mentally aging as well. We forget about the fact of free radical damage that we experience on a daily basis. Well, they do too. And so they don't often remember where the food bowl is. Some of them overeat just to overeat. They'll start to vomit. They don't absorb it as well. So you do need to change. You need to change everything from usually the nutritional content, because they're also going to need a little bit more protein, which is an interesting point in feline medicine right now. And there's a lot of research out there, because it used to be said as the kidneys slow down, maybe we should restrict their protein. Well, there's a lot of questions about that, because one of the aspects of aging is muscle loss, and these are obligate carnivores. They need protein. So there's a balance that needs to be found, and this often is needed with specific calculations from your veterinarian. But feeding small meals throughout the day, often incorporating canned food if your cat will tolerate that, is a great way. And sometimes they need an easily digestible diet for their nutritional needs, because their digestive system is not going to work the same as it did whenever they're younger.
What are some signs and symptoms that your cat may be slowing down?
So I think some of the most important ones to look for is sleeping more. Well, that one's funny, because we all know that cats sleep a lot, especially when we're not home. But changes in their sleeping patterns, okay? So maybe they're awake more in the evening than they used to be over the last several years. Maybe they're waking up in the middle of the night. One of the most common things that I hear in my practice is the night howling. That's a very important thing to discuss with your veterinarian, because there are several causes of that. So I think changes in sleep patterns is very important to address. Number two, I think hesitation to jump or hesitation to jump up and or jump down, because we know that, or in research we've shown that 92% of cats above the age of 10 have arthritis, and the number one sign of pain in the cat that I experience here at Cat Care Center is no obvious sign at all. So that's sort of scary when you think about that, because one of the things as pet owners, specifically our older cats, is that we love them and we want them to be comfortable. So I think watching for signs of jumping, behavior changes, sleep-wake patterns, eating changes, all of those things are something to consider when wondering or discussing with your veterinarian if your cat is potentially, aging and does need some changes that they might be able to help you with.
What are some health complications or diseases that are commonly experienced by senior cats?
So when in my practice, I'm thinking of 4 main diseases that I see, really 5, but the 4th one kind of goes hand in hand. I'm really big into practicing life stage preventative management here at Cat Care Center, which means I'm doing various blood works at the different life stages year to year along the way. And the next thing that I think is very valuable is when my patients reach that senior category, which usually is around that 10-year age range. I'm asking them to come in twice a year. They don't have to do blood work every year. They're not necessarily getting vaccinations every year, but we're at least putting our hands on them and repeating the blood works that's showing patterns. So the 4 big categories that I see here at Cat Care Center are going to be chronic kidney disease is a big one. Number 2, hyperthyroidism. It is the most common endocrine disease that we do see in the cat. And I think somewhere around 11% that we will have hyperthyroidism. So I do pay attention to that. The next one is diabetes. That's another important one, especially for some of those cats that have been heavy. They're males, more predisposed than females, but that's not always the case. So there are some females out there. We do have to watch those. And then the 4th is GI disease. So I do see a lot of GI diseases, whether it be inflammatory bowel disease, allergies that develop, or even cancer. We do have to look out for GI lymphomas and some of these other cancers. And then dental disease is a big one. So if I could say anything to my cat owners from what I do on a regular basis here is we do a lot of dentistry and we do a lot of dental extractions in our senior geriatric cats. And I do believe that early onset dental recommended prophylaxis by your veterinarian is a great way to do everything you possibly can to slow down dental disease. And then I'm gonna add, besides just dental disease, I'm gonna say arthritis is a big one as well.
What kinds of preventative care can help extend the life and health of my cat?
So we kind of touched on that in the last question, so I'll reiterate that again. Establishing a good relationship with your veterinarian and veterinary practice. One of the big things I'll say about Cat Care Center is my staff is extremely valuable to me. These guys know your cats and they know your cats so well that they are going to pick up when they look at your cat when they come into our hospital something that's not quite right. They also learn their blood works. They learn what your cat needs on a biannual or annual basis. And that relationship between your veterinary staff and the doctor and you is so important. And that's something that needs to be established early on, not necessarily when they turn 10 or 11. Yes, we can start that then. Please don't hesitate to bring your cat to a veterinarian if you haven't. But if you can get that relationship and that bond started early on, that I think is probably the single most thing you can do for prevention. The next thing is when your veterinarian makes recommendations and they have valid reasons and they go over them with you, consider letting them do the blood work. Consider letting them check the urinalysis, the blood pressure. We start that early on at Cat Care Center, and we do that for 2 reasons. Number 1, that's where we're going to determine the normals for your cat. But number 2, we're going to get your cat used to being handled and used to blood pressure in a feline-friendly manner, and have yourself a good staff that knows the ideals of a cat-friendly practice and is able to maintain those. And especially when they do get older and you're checking, for things as they age, make sure you handle them extra carefully. But a good preventative package maintenance with your veterinarian and a great bond with the practice is probably the 2 single most things that I would recommend as a cat owner.
What tests might a senior cat need?
So again, here at Cat Care Center, we usually are going to recommend that we do what's called our senior wellness blood work. That is a full chemistry panel that includes, in my practice, all the kidney values, SDMA, liver values, pretty much all your big chemistry values. We do a CBC. Sometimes we do a PCV, depending on because cats, one of the things about cats is when they're nervous, sometimes, their vessels, their blood clots a little bit. So we always do things as feline friendly as we can, but we always double check everything that we're doing here. So a CBC, a PCV, a blood pressure, a urinalysis is so important, guys. Don't skip the urinalysis, because when we're trying to detect these, kidney disease or something like that early on, sometimes the only thing I'm going to see when those kidney values and SDMA are normal is a specific gravity that's a little bit lower than it should. So please don't skip that. We also will recheck our feline leukemia FIV status at different life stages, because we do know, as of the new 2020 guidelines, that some of those viruses have changed, and it's important that we keep up to date with that. We do monitor fecal, we do check a fecal, and other than that, a good exam. There's just nothing that can take the place of a great exam and knowledge of that client with that veterinarian.
And last, what is the most important thing to know about caring for a senior cat?
So I think the most important thing to know is that, number one, congratulations, because for them to be with you into their senior years, I think that's really special. That means they've been with you through some of life's biggest challenges. They've been with you through maybe marriages, kids, etc. So you have a special bond there. So number one, acknowledge that bond, and remember that when they get older, things change with them. Their behavior changes. Maybe they're less needy or more needy. Give them the time that they need. Also, make sure you have a good established veterinarian that's with you every step of the way to help you think about the things that you may not be thinking about. And ultimately, as somebody that has a 20-year-old Persian who I love dearly, and with Millie, I think every day I look at her and I just thank God every single day that I have this beautiful cat that has been with me through every child I've had, through my marriage, through veterinary school, through moving, and I'm so grateful for that bond. So I think the most important aspect is loving them, taking care of them as best as you can every day as a gift, having a good veterinary care staff that's going to think about arthritis, pain, dental disease, diet, nutrition, behavioral changes. Here at Cat Care Center, I have a typed senior cat checklist here, and I go through the things that change. We talk about everything in your home that may need to change, from the way you feed them to how their litter box is managed to how you handle their sleep-wake patterns, all of those things. So, just have a good team. It takes a village. We all know that, but in senior cat care, I do think it takes a village. So, hope you guys have a good day. Hope you learned something. Stay tuned. We'll be doing some more of these as time goes on.